Hey guys, in this video, I'm going to review my test results that show I reversed a 70 to 99% blockage of plaque in my leg, and I'm going to tell you how I did it. So first, some context of where this testing came from. So I've eaten a whole foods diet and been very active playing sports my entire adult life. And due to being diagnosed with type 1 diabetes at age 9, I also adopted a low carbohydrate diet in my mid 20s because of how easy it made it to manage my blood sugars. Now, in June of 2020, at 33 years old, I was physically fit, my blood tests show my metabolic health was great, and my CAC score was a perfect score of 0, meaning there was no calcified plaque in the arteries of my heart. I was feeling pretty good at this point. However, at that time, I was dealing with a lot of stress. It was during COVID, and there were many things for most of us that stressed us out during COVID. But I was also going through some relationship stress, and I heard some very stressful news about a close family member around that time. A day and a half after I got that news, I woke up and did a high intensity workout, and 20 minutes later, I had a widowmaker heart attack. Now, an in-depth discussion of what caused my heart attack is beyond the scope of this video, and perhaps I'll make another more in-depth video about that later. Now, this left me in the hospital, and in the hospital, they just kept telling me that cholesterol is what causes heart attacks, and that I would need to take 5 medications for the rest of my life, which were a cholesterol-lowering medication, 2 blood pressure medications, a blood thinner, and a baby aspirin. Now, the only medication I decided to take was a low dose of that blood thinner for about 6 months since there was a stent in my heart. And since then, I haven't taken any medications. Now, further, 2 to 3 months after the heart attack, I started to develop pain in my right lower leg below the knee when I exercised or even when I just walked fast. I eventually went to a vascular surgeon and found out that I had developed a 70 to 99% blockage of plaque in my leg. This was caused by the heart cath intervention they did for the heart attack. Now, during the years that followed my heart attack, I stayed on my low carb diet, animal based, high in saturated fat. My total cholesterol and LDL were consistently what medicine considers to be highly elevated. At one point, my total cholesterol was over 500. Despite this, this is what happened over the next few years. At my 3 month follow up after the heart attack, my echocardiogram showed that my heart function had recovered substantially. My ejection fraction went from 35 to 40% after the heart attack to 50 to 55%, which is within the normal range. Now, the conduction of the electrical signal through the damaged tissue in my heart went from severely hypokinetic, meaning not conducting very well at all after the heart attack, to only mildly hypokinetic. The tissue had recovered. Now, at this time, the cardiologist was pleased and said that I must have decided to take my medications. However, he didn't really know what to say when I told him I hadn't decided to take my medications. Now, 1 year after the initial diagnosis of plaque in my leg, a follow-up test showed that the blockage had gone from 70 to 99% blocked to only 0 to 50% blocked. The technician was sent back into the room to repeat the test because the doctors didn't believe the test. However, she got the same result on the second test. At that point, when the doctor came in, he said, "Well, we can't say that it's better because we don't see these things get better," which to me strikes me as very uncurious about why this thing that they see doesn't get better got better. Now, a year after that, another follow-up test on the artery in my leg showed that the artery was now completely normal. Another follow-up test another year after that showed that it was still normal, and they told me I didn't have to come back anymore. Now, in February of 2025, 4 years after the heart attack, I decided to get some imaging of the arteries of my heart. So I did a CT angiogram, and I had it analyzed by AI software called Clearly. Here's an example of Clearly imaging showing someone with tons of plaque in their arteries and someone with clean arteries. Now, here's my imaging, and it showed that aside from a mild amount of plaque in my right coronary artery, there was no other plaque in the arteries of my heart. Even downstream from the stent was now clean. Now, just to recap, after a heart attack and diagnosis of severe peripheral artery disease, I was able to completely recover my heart function, reverse peripheral artery disease, and my heart arteries are very clean. I did this without medications and with cholesterol levels much higher than what doctors say they should be. So, what did I do to get this result? Well, I used an infrared sauna for about 20 minutes, 4 to 6 times a week. I prioritized getting more sunlight and getting direct contact with the earth. I optimized my circadian rhythm by setting my body to the day-night cycle of the sun, and I took the supplements serapeptase, taurine, magnesium, and strophanthin for about a year after the heart attack. So, That's it for this video. If you want to learn more about the actual causes of heart disease and learn more about why what I did got me the result that I got, subscribe to my YouTube channel or follow me on social media. Or if you want to work with me as a client, click the link in the description of this video to learn more about my heart health mentorship program. Stay healthy out there.